Hi, I'm Dr. Mariah Brown. I'm the Fellowship Director for Micrographic Surgery and Dermatologic Oncology at the University of Colorado. This video aims to answer the most commonly asked questions by applicants to our program. We also review the day-to-day schedule for our Mohs Fellows. The University of Colorado MSDO Fellowship is a 12-month program that begins on July 1st at the beginning of the academic year. The fellowship is based within the Department of Dermatology at the University of Colorado Anschutz Medical Campus. The University of Colorado has one of the oldest Mohs fellowships in the country. It was founded by Dr. Ramsey Millett and has trained over 30 fellows. There is one fellow per year, and all applicants must have completed an ACGME accredited residency in dermatology. This position is a PGY 5 level position, regardless of the years of prior training. Salary, vacation, and benefits are set by the University of Colorado Graduate Medical Education Department. The fellowship is under the auspices of the Department of Dermatology at the University of Colorado School of Medicine. The department chairman is Dr. David Norris, who has led the department in both clinical and research excellence during his tenure as chairman. The dermatology department at the University of Colorado consists of over 30 clinical and research faculty and has 20 dermatology residents. The department covers 4 clinical locations and has a strong emphasis on research, including the Gates Stem Cell Center. All MSDO fellowship training takes place in the Mohs Clinic at the University of Colorado Hospital in Aurora, Colorado, east of downtown Denver. The fellowship requires 5 days of Mohs per week. A typical day consists of 8 to 10 Mohs cases with excisions and flap takedowns in the afternoon. The fellow works with the attending physician who is performing Mohs that day. The clinic has a third-year dermatology resident rotating through Mohs at all times. There are also other healthcare learners, including medical students and rotating residents who are a part of the healthcare team as well. The fellow is first call for patients during the work week. On the weekends, the fellow provides backup call to the dermatology residents when needed. The fellow attends cutaneous oncology tumor board once weekly on Tuesday afternoons. This tumor board consists of multiple specialties, including Mohs surgery, cutaneous oncology, surgical oncology, radiation oncology, dermatopathology, and ENT. This tumor board discusses the management of complex skin cancer patients who present to the University of Colorado. The fellow teaches 4 to 6 didactic sessions for the dermatology residents per year. The fellow is also expected to provide bedside teaching for residents, medical students, and other healthcare team learners. There's no general dermatology or dedicated cosmetic portion of the fellowship. The fellow may moonlight at outside clinics, but this moonlighting counts toward work hours and is subject to specific departmental limitations. The fellow receives 15 vacation days a year and has educational days at the discretion of the program director. Funding is provided for the fellow to attend the American College of Mohs Surgery annual meeting, including the Fellows in Training pre-conference course. The fellow may choose to attend the American Academy of Dermatology annual meeting and the American Society for Dermatologic Surgery annual meeting, but there's minimal funding available to attend these conferences. The fellow educational curriculum is designed to provide a comprehensive education in micrographic surgery and dermatologic oncology. To this end, the fellow has educational didactics 1 to 2 times per week throughout the year at 7 a.m. prior to clinic. The educational curriculum includes 3 textbooks provided to the fellow for their personal use. These include Facial Flap Surgery, Flaps and Grafts in Dermatologic Surgery, and the Atlas of Practical Mohs Histopathology. The fellowship also maintains a PDF bibliography of over 1,000 articles on topics in cutaneous oncology, Mohs surgery, and reconstruction. These articles are a part of the educational curriculum for the fellow, with an emphasis on evidence-based medical care. The fellow is also expected to participate in the National Dermatologic Surgery Telejournal Club once a month. During the fellowship year, the fellow is expected to produce 1 dermatologic surgery publication for submission to a peer-reviewed journal or textbook. The fellow will also undertake 1 IRB-approved research study, which is expected to result in publication during or after the fellowship year. The fellow will also participate in the Cutaneous Oncology Research Meeting twice a month, run by Dr. Ryan Lanning of Radiation Oncology, with a focus on multidisciplinary projects in skin cancer management. The fellow will also design and execute a quality improvement project during the academic year. Upon completion of the fellowship, the fellow is expected to become board certified in micrographic surgery and dermatologic oncology. The fellow is also expected to become an associate member of the American College of Mohs Surgery upon completion of the fellowship. And finally, within 1 year of completing the fellowship, the fellow is expected to present at a national dermatologic surgery conference. If you would like more information about graduate medical education at the University of Colorado, please go to the following website. If you have specific questions about the fellowship that were not answered by these videos, please contact our program coordinator.